Hello and welcome to my channel. My name is Peter Abraham. I'm a registered nurse with experience in cardiology, medical surgical, long-term care and rehab, and extensively in hospice. If you're new to this channel, welcome and thank you for visiting for today. In this channel, we talk about different healthcare topics mainly related to chronic diseases that turn into terminal diseases and end-of-life topics. So in previous episodes, we've talked about anticipatory grief, grieving. For the past several episodes, we've been talking about items specifically for hospice nurses, such as establishing a baseline for our patients when we're doing our visits, that quick jot, that research jot, taking those notes of decline. The last episode I actually went over a recertification template and note that I did for a patient I had a few years back. Um, please ask questions. It's a very non-judgmental channel. A lot of times my content, both in book writing, I'm an author and a writer, is driven by people asking questions. For example, I have a blog, compassioncrossing.info, compassioncrossing.info, where I write articles about chronic and terminal diseases. And one of my Facebook friends who I met in the hospice and end of life group asked, what do I have available to help her understand chronic anemia and its impact on having breast cancer, as well as antibiotic resistant UTI. What does that do for the prognosis? So I will be working on an article in the near future for Compassion Crossing, just to meet her request. And a lot of this is done this is done freely. So I'm a geek. I'm a nerd. So I love researching. I love reading, and that's why that's why I write all the books that I write. Is I'll have somebody in one of the venues that I participate in. I need to know more about fill in the blank as it relates to healthcare, more specifically nursing. And then if I feel that this is something I can tackle, I'm going to do the research and write. So in terms of like the hospice and conditions of participation handbook, somebody was asking, if I want to be a director of nursing, what do I need to know? You need to know this inside and out. And this is new for 2025. This does also tie into the HOPE tool that must be implemented by October 1st of this year. There's HOPE in practice for implementation. There's HOPE in action for how to do it in the field. The admission visit, the hospice, the update visit, the special focus visits covered. Um, my initial book that I wrote, how to write audit proof documentation, or I should say audit proof. I might want to say your chance of failing an audit if you're writing the documentation the right way is like so low, and that saves your hospice agency lots of money. Um, mastering hospice eligibility. This replaces quick flips, in my opinion, and yes, I'm biased. I appreciate Dr. Andy, who spoke very highly of this book in LinkedIn in terms of the benefit that it gives. How to prognose. Again, I'm not going to go over every book for right now, but just I love writing. A lot of this comes from people, whether it's commenting on my YouTube channel or sending me a Facebook message or reaching out to me via email. Peter, I believe that you should write a note on this or that. Let me one moment. Here, Tanya Frazier, one of my fellow hospice nurses, uh, she was seeing a situation. Now, she knows this material before I wrote the material. too many of her colleagues were pushing oxygen when it wasn't needed. And oxygen is a medication. So Tanya was like, there needs to be more education for my fellow hospice nurses, as well as myself. It's not just me speaking about it. Could I write on this subject matter? So thank you, Tanya Frazier, for recommending writing a book on breath of life. So before I go on, if you like what you're seeing, like, comment, as I mentioned, subscribe. Before I go on for today's topic, which is an overview of a book that's being currently reviewed by Amazon now, at least the paperback and hardcover, I like to stop and say, what am I grateful for? And I really encourage you that every day, and as you're able throughout the day, ask yourself, what am I grateful for in this moment? This matters. You matter. And that's why it matters to ask this question, because in my experience of life, and I've been through a lot in life, and one of these days in a future episode, I'm going to go over my testimonial. And when I say that, just to be very clear, because there are some people who may not want to watch my testimonial, because I will be talking about Christ Jesus in my testimonial. And so I'm just giving you a heads up for, if you see that, maybe if that's not your cup of tea, you don't have to watch. I don't proselytize. If somebody opens the door, I will share the message. We're called to do that. But I've been through a lot in my life. I've been abused, and I don't want to go over that for right now. I've been through a lot. Without going down the rabbit trail of what that means, what I found in life is if we recognize what we're grateful for, we are more likely to be resilient, that snap back when we hit the floor. When somebody knocks us to the floor, either physically, emotionally, mentally, we're burnt out, we bounce back that much faster when we are resilient. And how do we build the resilience, especially in the field of hospice, where we're dealing with death and dying on a regular basis? From my perspective, we are as grateful as possible, as often as possible. So for me, this is Friday. I last published on Wednesday. So what I'm grateful for, I'm grateful that yesterday, after weeks of working through the book of clinical pathophysiology, tightly focused for hospice and palliative care nurses, I finally finished the book. I start writing in ebook format. I ended up getting it to paperback. Forewarning for when you see this. Most of my books, like this book here, this is 6x9. I do have a small handful of books that are 8.5x11. I try not to do these books mainly because of the space requirements that they take to physically store the book. But on the other perspective, Amazon charges by the page for printing costs, and then they take a chunk out of the royalties on top of that. And I try to price my books with you in mind. I want to make a fair royalty profit for the effort that I put in, but I don't want to charge so extensively for my books that you're going, gee, am I taking a college course that I'm paying so much for this book? Because a lot of my readers are individual hospice nurses. I do have agencies that are buying my books, but a lot of times it's you, the individual hospice nurse, who I'm grateful for, and thank you in advance, that are buying my books, and I want to have them priced reasonably. So when I initially took the clinical pathophysiology book that you're going to see shortly in a run through, and I put that in the my 6x9 paperback format, because I have templates pre-made that all I have to do is just copy and paste the main content in. It was like, this is approaching 500 pages. And that was before editing. So when I edit on paperback, I'm looking through for the flow. Am I going to cut off bullet points? Am I going to cut off tables? Now, some tables if they're too extensive, they do have to cross pages, but I try to do that very judiciously. And so I ended up making a decision for this book in order to have it priced where you could afford it and have it readability that it's going to make sense. I don't want to have tables crossing 3 or 4 pages because again, when you're talking, 6 by 9, uh, that's a lot of pages. So it is going to be 8.5 by 11 for the paperback. Hardcover, Amazon's weird. It's 8.25 by 11. So that's coming out later today. So I'm grateful I got that done. I'm grateful that we're on track for this month being at least 500 books sold of all the different books. I don't have any illusions of or delusions of grandeur. I am a small time book writer, and Amazon's the actual publisher of my books. And I'm grateful for every one of you, but we're on track for that. And that means so much to me. I continue to look for local work here in Kentucky. I did apply to a local job at Baptist Health up in Lexington, Kentucky, for their learning management system administrator. I don't know if I'll even get an interview because they're looking for masters trained. That's its own argument over degrees versus experience. But God is always good. So before I go on much further, let's get into the meat. I'm going to be showing you an overview of the book, also fine print. I shared in the last episode my video trial for Loom, where it could have like the picture of me. Not that I'm anything to look at, but it does help me as I'm overviewing because I could actually see where I'm at uh, from a perspective. I'm weird. My trial ran out, so last episode I used QuickTime. So I did find a MacBook application that I'm testing. So if you like this overview, not just the overview itself, but you say, hey, Peter, that worked out nice for that screen recording. What did you use? I don't mind sharing what I'm using, but please give me feedback. How did it come across, especially compared to the last episode with QuickTime? I would appreciate that. Anyway, before I go on much longer, let me show you the overview of the book, and then after the overview, I'll come back to speak briefly. This is a review of the upcoming book, Clinical Pathophysiology, a reference for hospice and palliative nurses. It's currently being reviewed by Amazon for the hardcover and paperback, with Kindle versions coming hopefully before the weekend is over. So this book is dedicated to Ed Braddock. Ed is a fellow hospice nurse. He participates heavily in the Hospice and End of Life Facebook group, for which I and many other hospice staff, patients, caregivers, and family members are part of. And he shows great compassion to the families and caregivers. And he's part of the emphasis for why this book was written in the first place. Oftentimes, families will ask questions after their loved one dies. I've noticed this or I've noticed that. And Ed will take his extensive knowledge of pathophysiology and explain it in such a way to the the caregiver or the family, that it just comes across very understandably in layperson terms. And it's because of him that reminded me, gee, I love learning. I'm a lifelong learner. I need to know more than what was taught in nursing school. I need to know more than what I learned hands on after 8 years in hospice. I need to know more than what I know now. So the cumulative research of this book is focused on the last 6 months of life. So there are other clinical pathophysiology books out there. I still remember from nursing school the big two gigantic anatomy and physiology books. This is just pathophysiology focused on the last 6 months of life. And what makes this extremely specific for rural hospice nurses is this is focused on observable signs and symptoms that you can detect with your observation skills, your interviewing skills, a measuring tape, a stethoscope, a blood pressure cuff, a pen light, and not in needing laboratory confirmation, although that's always nice, or imaging confirmation, which is always nice. So this is a 10-chapter book. I'm not going to go through every chapter. This is just a very light overview of this upcoming book that's being published this weekend, available on Amazon.com. So let me just go over the table of contents very briefly. You've had a chance to read at least the overview for what's going to be involved in the first 3 chapters. And let me move my picture out of the way. We cover all the major organ systems. Let's not forget skin's the largest organ of the body. We do cover hematologic and the immune system. So when I say we, I'm really referring to myself as the author. Go over multi-organ dysfunction, looking at prognostic patterns. When we're out there in the field, even when we're talking about is this organ failing or is that organ failing, a lot of times it presents itself as a combination. So we're looking at those clusters of systems to help us make our judgment calls. The conclusion, encouragement points, references, which are APA formatted. I have a number of appendices to really help you out there in the field. There's breathing patterns at end of life, modeling progression. Most of you probably know the signs and symptoms of transitioning and actively dying, but there is a very detailed refresher, rapid reference checklist, including a flow chart for differentiating shortness of breath and aka dyspnea. How do we maximize the use of our equipment? In doing research for this book, I came up with, hey, there's a way to use your tubing in very noisy environments, whether it's in a home or in a facility, to hear better. What can you do if the pulse ox you're having issues? When you do have lab work available, what do those lab numbers mean as it relates to hospice? We're not in the hospital setting, so we treat lab values a little bit differently in hospice. The toolkit perspective, how to have that mental model of decline, looking at the 3 Ps, which we'll go over when we get to that appendix, and looking at system clusters, and then a glossary of terms. So then again, looking at observable signs and symptoms. This is just the introduction, just going over. Common disease trajectories. The conclusion. Now, when we get to the actual meat with the chapters, in every chapter, there's multiple clinical alerts. So if you are seeing these things, here's what to either expect next or do next. This book is not a symptom management book, but is meant to just guide you as to what to expect next based on what you're seeing and how to understand what you're seeing. There's real world nursing scenarios in the different sections, clinical decision points, assessment challenges and solutions that we see there out in the field, clinical pearls of wisdom from other hospice nurses, nurse practitioners. And again, we're looking at how do you notice this at the bedside out there in the field. I try to use a lot of tabular data just to make things easier to see and assess, cardinal signs, so on and so forth. And then again, I'm not going to be going through every chapter, but let me just go a little bit quickly here towards chapter 10, chapter 6, we're getting there. almost to chapter 10. And this is where we look at the universal clusters. Again, I mentioned about the clinical alerts, how the systems interact with one another. Again, this is highly focused to the last 6 months of life, with a lot of this focused in the last 3 or less months of life. In conclusion, the APA references. Now we get to our appendices. These are just waveforms. Again, clinical pearls when you're hearing the different breathing patterns, seeing the different breathing patterns. Progression of modeling. When you get up to the knees, that's very telling. It usually doesn't progress that far before they pass, but if you are, if they're hanging on there and you're seeing this progression, it just gives you more clues to help educate the family that we're getting closer, and you can give them more visual signs that they can see, so that you're building trust all along the way. That trust with the family is so important. Um, Transitioning and actively dying. Again, many of you already know this. This is just a deeper dive into that. Again, by organ system. These are your rapid reference checklists. Just giving you a moment to briefly read. And you could pause the screen. When it comes to shortness of breath, at the end of the day, where the origin matters, it could be argued, does that matter? I'm going to treat it anyway. But if you wanted to be more aware, are they having shortness of breath because of cardiac reasons? Are they having shortness of breath because of metabolic acidosis? Are they having shortness of breath because of respiratory? This helps kind of break that down as to where the origins for the shortness of breath. Uh, you're going to have some providers that their treatment options will be based on the origin. So that's where this can matter. If you have those doctors, I need to know, is it because of this or that? Well, you can then get into fine tuning, and that builds trust with the doctors. That means down the road, when you're in a situation where between you and I, you're taking a guess, but you build up such trust with the doctor that when you give your S bar for that recommendation, even if it's a leap of faith on your part, they're more likely to go with you in that leap of faith if you've built trust all along the way in your relationship. This is one of my favorite appendices. I learned a lot from this, even though I've been out in the field, predominantly being a rural hospice nurse. There's certain things I was not aware of. Like I was aware of the S3 sounds with the Kentucky and the Tennessee, and I liked living in Kentucky now. But like in terms of noise mitigation and some tricks for handling the noisy environments, or sometimes those monourinal stethoscopes. I'm a geek, so I have multiple stethoscopes. I'm usually carrying two in my bag. I have a primary and I have a secondary, and I typically have one in the car in case I forget my nursing bag. Have any of you ever run out for a death visit, and maybe you have the certificate separate from your nursing bag, and you get there and you don't have a stethoscope? I'm guilty of doing that. So there are times where having those very inexpensive monolaural stethoscopes can actually be a benefit. Some blood pressure cuff techniques, same way with the pulse oximeter, measuring tape notes. I did mention when you do have lab results available, we look at lab results differently. We're not trying to fix the lab value. No, I wish we lived in a world of no fine print. So the fine print is if the lab value indicates that they're a high risk for seizures, yes, me personally, I'm going to be on the phone with the doctor. Could I get, routine lorazepam, depending on their ability to swallow, unless we're using a MACI catheter, or alternative administration methods? Do you want to go down with levetiracetam, Keppra, in terms of seizure prevention? Because that's very uncomfortable for the patient and the caregiver. But outside of that, I'm not really trying to prevent or modify the lab values. I'm looking at how do lab values impact comfort. Um, so that's part of the key principles for that, and then just using that for education. Then the hospice toolkit, pathophysiology and practice. We're looking at system clusters. The clusters, the velocity decline, all that helps us to come up with a prognosis of how much longer somebody has to live, with the understanding we're not God. 3 P's framework, patterns, the physiology, the prognosis, case examples, documentation for care continuation. This is not a documentation book, but I do touch on documentation. I do have a separate book for documentation. System clusters again, glossary of terms, my short bio. So that's it for this book. The paperback and the hardcover, I'm hoping, will be either available late this evening or sometime tomorrow, with the Kindle version again this weekend. The time of this filming is March 28th of 2025. Thank you so much for your patience in watching that overview of this upcoming book. It should be available best case would be tomorrow, Saturday the 29th. Amazon sometimes gets particular about paperback and hardcovers, even though when I do the review and their quality checks, it appears to be within all of the lines. We'll see. Kindle version should also be out this weekend as well. Worst case will be Monday morning. So again, thank you so much. Please do comment in the comments below if you have questions on any of the books I've written to date. If you have an idea for a book you'd like me to write, or an article on compassioncrossing.info. You have questions about being a hospice nurse or a palliative care nurse, are very similar. Palliative care, not so, how to phrase, you're more focused on, kind of phrase, balancing comfort and cure, where hospice is comfort only. If you have any questions about grief or grieving, I don't want to go on with the questions, but if you like what you're seeing, comment, subscribe. I really appreciate your time. I do appreciate any and all of you who are buying and reading my books, or recommending them to others, or all of the above. Thank you. God bless, and have a good day.